Thank you so much for coming and joining us for the second day of the HS Awareness Virtual Summit. Today we have Dr. Erin Martinez here to talk about mental health and sex in relationships when dealing with HS patients. And we're also going to talk about how caregivers can support HS patients through mental health as well. Before we get into our conversation, I want to thank our sponsors, the HS Foundation, the Mama IU, For Her Cosmetics, and HydraWear. Thank you so much for your donations. They are the reason we are able to do giveaways. They are the reason we are able to put on this programming. So we thank you so much. Dr. Erin Martinez is a sex therapist and also a social worker. I want to give her opportunity to introduce herself and kind of tell you more about what she does and who she serves.
Thanks, Jasmine, and thank you for all of you for joining us. I'm so excited when I heard you were putting this together. I think it's beautiful, and any opportunity we have to increase access to services and information, I think is so imperative. I have worked in the field of mental health and emotional health for 25 years, and I'm really passionate, probably most passionate about trauma healing as well as access to care and increasing access to care for people. We talked a little bit before the summit started this morning about the idea of talking about how to increase access and how to even interview other people that are providing mental health services. So I promise to get to that a bit in the end of our talk today. As Jasmine mentioned, I'm also a clinical sex therapist. And so part of my work, I think that I came to that is I was spending probably most of my career working with how people were hurting and how they had been traumatized either by what had happened to their body, or, you know, so many sorts of assaults can occur, both from external sources and then within us. Medical experiences that happen to people can also be a form of trauma. And I think that becoming certified in sexual health and sex therapy allowed me to help figure out what are the solutions and the interventions that really bring about healing. So I spend most of my days sitting and talking with people and helping people figure out the interventions that will fit for their lives, because, you know, like, I think that's still an accurate thing to say, that each snowflake is unique, and I think that each intervention plan has to be very unique. There is not a cookie cutter approach to people's stories or what they need. So developing, you know, each individual plan for somebody is really what I feel like I do each day. The one thing I'll add to that is that I think that historically we have had doctors that take care of our bodies and therapists who take care of our heads, supposedly. And I think that we are really reaching a point in our world where we need integration and we understand a biopsychosocial approach. And so I encourage people to look for that. We'll talk a little bit about modalities that you can look at that are more specific to the body and the spirit and the mind healing together. That to me is really what's most crucial about the work I do.
Absolutely. Thank you so much for that. And I do want to mention before we get into the conversation that we are going to have a Q&A that's going to be 15 minutes at the end. So if you have any questions that you want to ask Dr. Erin Martinez, then you can put that in the Q&A button at the bottom. We already have someone who has entered in a question, and we're going to address that after when we get to that portion. So if you have any questions that arise, just jot them down or write them in this little bubble, and we'll have the opportunity to answer them. Because we're here to serve you. So we want to make sure that you are, all your questions are answered. Dr. Martinez, can you help us to understand what hidradenitis suppurativa is from your perspective?
Yes, and let me apologize ahead of time for losing a layer. It's actually about close to 90 where I'm sitting, and I don't have air conditioning. So I'm going to forego being professional and try to just be cooler and relaxed. So when Jasmine and I were talking about this a little bit earlier, I was thinking about how I explain HS to my colleagues and to other people to increase information and advocacy. So one of the things that was both saddening to me and also upsetting was when I talked to many of my colleagues who are sex therapists across the country, and they weren't familiar with HS. This is part of the problem I've heard people repeat time and time again, is the misdiagnosis and the need to have to educate everybody that you encounter because they don't know the information. So I feel that part of my work is really educating those that I work with, as well as people I talk with on a daily basis. I told at least 15 people in the last 5 days about this summit. And a lot of people were like, what is HS? And that's a great opportunity to increase information. So I usually describe it as a dermatological condition that's often misdiagnosed. I also refer to it as a chronic health issue. So it's not something that can necessarily be cured. And I think that to me highlights the heaviness from a mental health and an emotional health standpoint of this disease. And so that's really important for me to represent those two pieces. I also mentioned right away when I talk about it, the importance of how it shows up for people. So I mentioned that this could be something that could initially be noticed as something like a blemish or a pimple, and then develop into something larger that fills with fluid. And I think it's so important to tell people that this is happening in some of the most important parts of our body to us, right? Parts that bring us pleasure, but also that can bring us shame and pain and hurt. And so I think it's important to highlight these could happen under our armpits, on our buttocks, in our genitals, on our upper thighs. And so this is really both emotionally painful and physically painful, and the interventions are not easy for folks. So I try to cover all those bases, and I answer the questions I can right up front with my colleagues and other people I'm trying to educate around. But I think that those are the main points I cover right up front.
Mm-hmm. Absolutely. And I feel like that's a great definition and way to explain it, because it can get very complicated to sum up how this affects patients' lives. And I feel like now I've just gotten the kind of like my spiel together on how to like tell people where it's not so overbearing, but it still gets the message across of what it is, you know, without going into extreme detail and whatnot. But that was perfect.
Thanks,
So
Jasmine.
with that being said, I kind of want to dive into the topic of mental and emotional health. So how do we begin understanding how HS impacts the mental emotional health of patients?
Okay. So when I think about, these aren't book definitions, these are kind of my definitions I work from. When I think about mental health, I actually think about diagnosis. I think of issues of symptoms, which are what lead us to a diagnosis, and also level of distress and functioning in multiple domains of life. These are some of the core ideas that we think about when we think about, is there mental health, or is there a problem with mental health? So when you think about depression, for instance, which I think is a really common diagnosis associated with people that are suffering with HS, we're thinking about excessive amounts of sadness. So we highlight their distress. It's happening throughout multiple places in people's lives. So it's interfering with work, it's interfering with personal life, it's interfering with daily functioning. And the distress level is usually moderate or severe. And I would say with people that I meet with that are actively in an intervention stage or pursuing, for instance, like considering a surgery or new to diagnosis, it's often common that I would see a severe level of depression for those folks. That's different than sadness, right? That's not, we all feel sad. And in this world, that's a pretty common experience. Depression takes hold of you. That's a mental health piece. People in my field are horrible about talking about and considering emotional health. And when I think about emotional health, I think about how our relationships are functioning. What is our connection to the spiritual? How do we connect to our own personal selves? What is our balance in life? These are questions that I think are as important as mental health, but I don't think we ask them with enough and gather enough information as mental health practitioners. So the most common issue that I see people experiencing with HS is probably grief and loss. Not a formal diagnosis, but when you have a chronic health issue, especially HS, because it interferes with parts of your life that are also very crucial parts of identity. And in that way, I think that it wreaks havoc it forces you to really have to grapple with who am I and who do I have to become as a result of this disease. So I think grief and loss is probably one of the most common issues. I think anxiety and depression. And then I mentioned the idea of trauma, another place, and I'm just telling you everything awful about our field right off the top, but our diagnostic manual doesn't have enough information about complex trauma. And I think medical trauma exists, as well as what happens in the course of feeling isolated because other people, one, may not attempt to understand what you are going through and will maybe even leave you. You put that difficulty next to all the difficulties our world is throwing at us. And I think that there's a common experience of trauma associated with HS, but yet we don't really have accurate diagnostics except for PTSD, acute stress disorder. They really don't fit the bill. So I think an important piece when you are seeking out support for your mental and emotional health is to have the flexibility of a practitioner that's not just going to stick with formal diagnosis, but talk about emotional and spiritual health too.
And I think that's interesting that you mentioned that, because I think that therapy can sometimes be extremely formal. And with HS patients, I feel like it just goes a little bit deeper than that, just because it's so chronic and it's something that you deal with constantly. And so with that being said, I know that you work with like the HS Foundation. When you speak to physicians about how to deal with patients who have HS, what does that conversation look like? How do you inform them on sort of like handling patients, not only physically, but paying attention to the mind as well?
Yeah. So I'm going to tell you kind of one of my most, my professional awful moments. And it was it was really a great learning experience, but I had the opportunity to speak at the HS conference out in Toronto. And I was in a room filled with brilliant medical doctors. And I was presenting in 10 minutes, and there's the timer and you get 10 minutes and you're in a lineup of people. And I was the only mental health professional in the room. Wow. And there was data and there was statistics and there was their research. And I wanted to talk about people. And I wanted to talk about what happens to people when they have a diagnosis that is life-changing. So one of the things, instead of running out of the room, which when I realized how different my presentation was going to be than everybody else's, I had that like third grade moment. I kind of wanted to just run out of the room. Instead of doing that, I did just highlight, why is it so different? Because I think doctors have so much to share in that short amount of time they have, but they don't ask about how's it going with you and your partner? How are you managing through stressful events with your family at home? How are you feeling about yourself? Are you having a sexual relationship with yourself or other people? Do you need somebody to talk to about that? What's the level of sadness? We forget people are human beings, and if those parts of their lives aren't going well, it's actually going to inhibit physical healing. And so that's where I partner with doctors. That's where I say, hey, like if we can work together on this, at least in referrals, at least in connecting with one another, then people are going to have better healing potential with your medical interventions. And my hope is I really do see that changing. I definitely see it changing with doctors involved with the treatment of HS, but I see it in the larger field I think it's coming from a place where we realize we can't get people better just focusing on their body alone. And I can't get people better just thinking about their mental piece. I need to connect. We need to connect it all. And so I think those are the conversations that are most important to me. And with doctors, you got to have them quickly, like
exactly.
2-minute punch, right?
Right. And that's interesting because I feel like that goes into the next question of like being grounded. Like, I feel like as an HS patient, being grounded in our bodies is very difficult. Being present every day, especially when you have something so chronic, and then also experiencing PTSD because you're always anticipating a boil. You're always anticipating inflammation. You're anticipating whether something's gonna burst, you know what I mean, in the middle of of being out in regular life, and you might not have all the dressing, or even if you do have the dressing, it seeps through, you have all of these different factors that go into being an HS patient. How does that affect the mind, just from your perspective?
That I don't know if I could do it more justice than what you actually just described there, because it was a perfect example of hypervigilance related to a medical condition. I think that one of the things that actually, when I got your email about this summit, I thought about was this idea of Judith Herman, who was really the first person to recognize that trauma occurs and PTSD occurs outside of war. And she identified 3 stages really of trauma: safety and stabilization, remembrance and mourning, and then, and this is the part that made me think of your work, Jasmine, like reconnection and integration. And when I think of the stages of healing, I think that those are what happens for folks when they're in it, when their body is reacting in a way that they have lost control. And the loss of control and the feeling of helplessness is key to what experiences of trauma. You really are in a position of just needing to stabilize, to be surrounded by support, to know that your doctor is a text or a phone call away. Those are the key pieces that are really need to be occurring in your life and in your treatment. When you think about the next stage, it's when you start to think about, I actually have to grieve the life I don't have anymore because of this diagnosis. And that is painful, and you need support around you in a different way, and from your partners in a different way. Yeah. And finally, you get to a point where, like, I want to educate, I want to advocate, I want to give back to my community, which this summit is proof of, but I think all pieces of that, our partners as well as ourselves need to understand, where are you in those stages? Because to have the expectation that you're not in safety and stabilization could be harmful to you, and vice versa.
Mm-hmm. And speaking of partners, I think that's a good segue into this next portion, which is, this is sort of a 2-part question. So the first part would be, how do patients begin talking to loved ones, especially spouses, potential boyfriends or girlfriends, or partners just in general, about HS? When is it a good time? Because I feel like that is always the question, do you say it on the first date? Do you say it when you are deeper into it? Like, you know what I mean? When do you have these conversations? So I don't know if you can give some advice on that, and then we can come up with the second part.
And you named it, like, Jasmine, that is the question. I feel like so many people, that is something that we run through. It's interesting because, not to be a broken record here, but I think that it again, just to highlight how it's about trauma, that's also a question that comes up often for people, like, at what point do I tell my story? Right. Because it's not just what's going on with my body, but this becomes part of my story. So I like people to be empowered that you should have your loved ones prove what they're about and what they can offer you before you take that leap. And I suggest trying it with something that doesn't feel quite as intense emotionally to you. So, and see how they react, right? This sounds a little judgmental, but I think we have a right to test other people out to know how they're going to react and what type of support they're going to give to us. So I might say, try out something related to, a family problem or a relational problem or an employment problem, and see, do they kind of run away from it? Do they stay steady? Are they grounded? Are they present to you? Do they ask about support? Are they dismissive? I think another really helpful piece with people that we know a little bit is preparing them by telling them, here's what I need from you before I even tell you this. Here's what you can do, and here's what probably is not going to be helpful. Because 9 times out of 10, the desire when someone feels overwhelmed with, my gosh, that sounds like a really difficult disease to manage, they give advice. And I feel like most people in the room would agree, the last thing I want is your advice at that moment.
Right.
Right? So prepare them. What I'd love to hear from you is a question. What I wouldn't is advice, or I'd like you to just sit with this and maybe we can talk about it later. I think also you have the right to tell things in increments that feel comfortable to you. It's about your comfort, not necessarily the other person at that moment. And so thinking about how do I break down what I'm experiencing in chunks and deliver that. The last thing I'd suggest is practicing and writing down what you want to say beforehand and noticing for yourself where shame exists. Because that isn't something you should have to carry. And that's a burden that's holding you. So notice that and try to work either with your own self-compassion work or even with a therapist to try to upend that shame. Because and sometimes just writing out, here's what I would say, here's how I think they'll react, can reduce the anxiety of it too.
Absolutely. And I think a great way to kind of like piggyback off of what you were saying of like helping to introduce in like increments, it's like when situations come up. I remember the first time I introduced my friend to one of my best friends to what I was dealing with is I asked her to come to the doctor appointment with me because we were already out. So it's just like, she was there in the office. I don't know if she fully understood everything that was going on, but I think that's an integration into that life and what I'm dealing with. And that might be big for someone to do, but there are smaller ways that you can do that, whether it be if you have pain or something like that and someone asks you what's going on or what's wrong, and that's your opportunity to tell them, hey, I'm dealing with this chronic skin condition. And you don't have to go into like extreme details, but you can just let them know, because that lets the experience be less isolating. And you have more people who are aware, even if they might not be able to help you. That's one more person who's educated, and that's one less moment that you feel like you're by yourself dealing with this condition. At least, I don't know if you agree with that, but.
I love that. I love that so much. And remembering, I think your friends showed up. When they don't show up, being able to talk yourself through, that's on them. That's what they couldn't handle, right? It's not about you. Because this is a disease of toughness too, and resilience, and not everybody has been through that path in their life.
And I think that's interesting because I think a lot of patients I know at least for myself, before I did the documentary that I did, I was afraid that how people viewed me would change. A lot of people that I was in romantic relationships with and didn't know that I had this would look at me as disgusting, or, my friends would stop being my friends because they thought I was a burden. My parents and my family already knew about it, so I wasn't worried about them. But outside people, I was just like, what are they going to think about me now? How do patients work through that? And what are some steps that they can take to sort of push themselves through that just at their own pace?
Yeah, well, and I'm glad you said, Jasmine, like the issue of pace, because I think that it's sort of like the grief and loss, where sometimes we make it here and we got to go back. And it doesn't mean that we failed at something. It just means that there's some work undone there. So everybody's pace is a little bit different. I guess I feel also that part of how the world defines us as beautiful and as sexual people is that's something I get to work with a lot in my field of work, is just generally pretty awful and inaccurate. Most of how we think about ourselves, even as sexual people, is informed by, oftentimes by pornography, but by really limited scopes. And so I think that part of what I think about when you experience some of the things you're talking about, how will people react? And we realize that our fears are based on some of these ideas of what the larger world feeds us about ourselves and how our bodies should be. I think that we, at our own pace, need to challenge that, and we have to broaden our scope. It actually, I find that my treatment with sex therapy and chronic health issues, people, and it's shocking, but people generally have better sex lives than they've ever had because they had to get out of this little performance-based box of sex that I'll tell you, most people aren't actually very happy in to begin with because it's limited. But you have to go on a journey of coming to have a new relationship with your body, and in that same way with your sexual self. And I think part of that, you know, again, it's a pacing issue, but one of the suggestions I made in the handout is even coming up with a map of the body and highlighting the parts of your body that you feel maybe disgust, maybe shame, maybe anger with. And then highlighting the parts of the body you've kind of forgot about. Somebody said to me last week, like, I never knew I had great eyebrows till I worked on the body map. Like, I love my eyebrows, they're great. But, you know, I think that when there are parts of us that don't feel right because of the world's expectations or our own expectations, we highlight them in our mind and it becomes all we can see. So having exercises like the body map that open up our scope of ourselves and help us look outside that box, I think are really important.
I think that's a good segue into talking about sex and HS. Because that's huge. A lot of times when you have anything affecting the skin in the sexual organ area, people automatically think STDs. And then not only that, there's a negative association with STDs as well, just in general, because people are afraid to catch them or get things that they can't get rid of, and then people become shameful. So on both ends, on HS and people who have STDs and STIs, which nothing should be shameful about something that you can't control or something that just happens to you, you know? So how do patients begin working through just whether they've had sex and they're now being sort of redirected or having to adjust now that they have this condition, or they've never had sex and they're trying to they want to have sex with their partner? How do patients start to work with that?
Yeah, that's a beautiful question. I think that what the two groups you just outlined have in common is we got to change the script. We got to change the script on how we talk about it, because what we're trained really because of our horrid sexual health education in this country is not to talk about it, right? So we find ourselves, I mean, this is largely what goes wrong with conversations around STD and STIs and consent, is they don't happen. And then if you add to it an illness like HS, the conversations again don't happen. And that creates hurt and shame and fear. So I think both groups need to change the script. And when I say that, what I mean is, I'll be a little graphic here for a minute. And I'm used to being like that all the time. So if the listeners feel overwhelmed, that's not my intent. I just want to be honest with an example. All of our bodies work differently, but if you think of, for instance, having vaginal penile sex, there's lots of messages we hear about size. If you actually look at the nerve tissue of the vagina, most of the nerve endings are right within this entrance point right here, like this size right here. It's just a myth. And sure, you can like it for a lot of different reasons, but if we're just talking about the medical ways, the biological ways our bodies are built, somehow we came up with a really different story about bodies than it is actually true for how most bodies will gain pleasure. In the same way, we were given a script about how pleasure should work, and it actually is a very medical version. It doesn't talk about what's sensual. It doesn't talk about what's erotic for a person. It doesn't talk about fantasy. It just is this kind of thing in and thing out on the body. And it's so limited. So whether somebody has never had sex before or they have had it, either way, what I want to help them think about is what are new ways that you can respect and love and explore the sensual in this body. I give the example that a lot of people have orgasms and have lost feeling from the waist up, right? You don't really need your genitals to have an orgasm if that's even your goal. You don't need to have an orgasm to have connection. And so again, if I reference the body map, if you start to focus on parts of what feels exciting and erotic or even sensual to you, then you begin to focus on those areas. And I would say if you can talk about that with confidence with a partner, if you can say, as an example, you know what I'm in the mood for today. You know what I'm actually really excited about. And here's what I would like to get out of this intimate experience with you. You can get a lot of things out of an experience. Here's what I want to get today with you. And then you identify ways that you might be able to capture that. That's a whole different way that we've ever explored having intimacy, because we need to go from this is what it is to like this is what it is, right? And that might involve visualization, that might involve things about levels of touch and temperature, that might involve the fantasy you share. You could really get creative, but I think you have to be willing to say, I don't need to stay within this limited way I was taught to be sexual.
Mm-hmm. And I think that's probably one of the biggest barriers to getting, like, to empowering ourselves through sexual health. It's just getting out of this small framework of
That's
what
right.
we thought, you know, and that might be uncomfortable because I know that a lot of people come from different backgrounds, religions, families. So sex isn't necessarily talked about, and it's not experienced the same way, just because of history. And I feel like I want to encourage everyone to do things at their pace in their time, because everything's not going to be comfortable for you right off the bat. So you might not want to go from missionary position to BDSM. Like that might be too much. That's a huge leap. So you might want to slow it down a little bit. So I think that's very important too. And it's interesting because I know that we're not really getting into the different kind of like sexual like play and positions and things like that. But I've done some research within like BDSM and things like that. And that involves sometimes not having penetration, but you still have the sensations of the sexual experience. And that might be good for HS patients only because you might be fully clothed and you might still feel empowered, but you don't have necessarily the fear of the shame that might come, with exposing your body, essentially, I would say.
And just because you open the door, just give me a minute on this topic, right? Yeah. Because here's the thing. I think when people think about BDSM, we think about often what the world serves us up is an extreme version. There is so much that you could explore in terms of what occurs in the play in your mind, the excitement in your mind that you can then bring out with another person or people in that, exactly what you're saying. But the sensual, the erotic is happening up in here, right? We can play it out with how we want to do that with another person, but that's a mind switch. And if you can really embrace that, there's so much potential. So that's maybe like Virtual Summit 2.0. We can go down that path, but I'm so glad you brought that up because I think it's just like it's a whole nother way of thinking about things that has so much potential.
Yeah, I grew up in a household where we talked about sex a lot. So I don't have a problem talking about it. I know that some people, I'm sorry if you're uncomfortable with it, but I just want us to be open because I I think that it's a topic that needs to be discussed, especially from a patient perspective, because I know that my sexual desires don't go away just because I have HS.
Right.
And I know that that's true for a lot of people who have chronic illness just in general. That sexual desire and that connection and that need for intimacy doesn't go away. It's still very present. And I feel like it's important for us to know how to honor our bodies, honor our desires in a healthy way, you know?
That's right.
So I kind of want to get into the next question, which is, how can, also, I'm sorry, let me go back. For those who don't know what BDSM is, can you explain that to them real quick?
Right. So people used to think of it as S&M. That used to be the term, like, I guess, like 30 years ago. So that would be sadomasochism. And the BDSM is bondage and discipline sadomasochism. So what you're thinking about is, how do you play with control? And how, for some people, how do you play with pleasure and pain? But pain is not inherently like a piece of the puzzle. I would much more explain play as well as aspects of parts of personality that we bring out in control and in interacting with another, that we can kind of bring alive a fantasy. There's so many misconceptions of that, but I think, again, the population that is able to, again, open themselves up to, I'd like to learn more about BDSM or power play in some way. They are definitely by far the people that are communicating the most, and they are doing the best with consent, because part of the rule of that is that you lay out and you be clear about, here's what I want to get out of this experience, here's what I don't. And there's a great connection with HS and sexual pleasure, because you have to have the empowerment and confidence to say, this is my body, welcome to it. Here's where I'd like you to be. Here's where I don't. Here's the pleasure I want to have, and here's what I don't. And what can I do with you? Right? If you can have that conversation and you can steal that, even if you don't want to explore the power and control moment, which maybe don't write it off, but even if you don't want to do that, steal that, because that's the place of great confidence. So thank you for opening the door a little bit to that, Jasmine.
Absolutely, absolutely. So that kind of goes into the next question, which is about how caregivers and partners and parents, how they can support. Well, actually, I'm sorry, let's not get into that question first. But
okay,
how can spouses and partners support patients as they learn to support themselves mentally and even sexually?
So I'm going to go back to what you said about pacing, because I think that's really, really important. And I'm going to remind people just about that idea of stages. Whether we think about the stages of grief, which we're pretty familiar with, people throw out that idea and they usually know, there's sad and there's bartering and there's anger. But also the stages of trauma, I think, really can help inform us, because again, if I'm new to my diagnosis and I'm just trying to grapple and put my head around, what does this mean for my life? That's a place of stabilization. And my partner and my family's support in that might be respecting that I need to be alone. Or it might be respecting, I need you to come to the doctors, but please don't even try to come in. Or maybe come in and take notes for me because I'm so overwhelmed with what's going on. And that level, so I would ask, I think the best thing to do for a partner, a family member, is to first ask, what do you think the need is I could fill in your life right now? And likewise, I think as a partner in return, you have to be open to hear what's going on for them emotionally. So here's what I need. What is this like for you as my partner? Because you don't want them to speak about your feelings. You want to know what their experience is like. You can hold that. You can respond to that. But when people start second guessing, I think I know what's going on with you and what you should do with your life and vice versa, that's when we get into resentment and misunderstanding. So I think the survivor, the patient of HS is the expert. But I think you have to be willing to take a look at, what am I going through in my life at this stage? And what do I need for support from myself? And what do I need from partners and families? And then be honest, some of my family members are if I really look at them, they're not super big feelers. So though what I ask from them, I'm going to keep in mind what their potential is to give, so I don't set myself up for a fall. I would have check-ins too. So I would have those conversations on a regular basis, and I would have them in a safe and calm place, right? So don't have the check-in when you got 5 kids around the table, the dog's biting and barking, and you're like, how's the HS thing going, right? That's not the moment. But have the conversation at places where you can relax with one another and say, I feel like I'm entering a different stage, or I feel like you're doing great at this, but I still need more of that. Also remember that you are creating communities with other people that are informed. And when you do that, you don't have to ask everything from one person, but expand who's around you, even in ways like this, to be in community with other people who get it. Like, that just feels good, I think.
Yeah, absolutely. I think that gets to our last question before we get into the Q&A. What are some ways that patients can, so I mean, we obviously are encouraging patients to find therapy, to find a therapist that works for you, just so that you can work with a professional on your mental health, your mental and emotional health. However, for those who might not have the access to that at the moment, what are some tools that they can use outside of the therapist's office to manage their mental health?
That's a great question. And so I'm going to answer like 2 parts, because I know I want to save time for Q&A. So just a quick shout out, if you are thinking about a therapist, go in with the questions you're allowed to ask about, interview them. Ask them about how formal or informal they are. All my clients call me Erin, and they all have access to texting me, right? Like, I'll tell you that first. I'll tell you how much I'll share about myself. Also ask about modalities. I would highly encourage folks with HS to think about, I would ask them, how comfortable are you about talking about intimacy and sexual experiences? I need to incorporate that. Do you incorporate the spiritual? I would ask them, if you're not informed, are you willing to get informed about my diagnosis? And I'd also ask about their modalities. A lot of therapists only work within the cognitive behavioral therapy standpoint. It's a great thing, but if it's very limited, especially if you're dealing with something like HS. So I'd ask for things like, do you do EMDR, eye movement desensitization reprocessing, right? It's about bilateral movement of the brain. I'd ask about sensory motor therapy, another way to bring the body, what the body is holding on to, out into the therapy. And so I'd ask about modalities. I think those are really important. On your own, in the work that you do, I think the most important things that, and I know you and Jasmine and myself have talked about this so much over the years, and I think you're a real advocate of this. Think about your routine and your schedule, your nutrition and your movement. If we were all doing this in the world, our world would be so different. So make sure your routine has some sort of balance. It has balance in terms of what you get and need for yourself and your connection to other people. I would also encourage you to think about how I can even, if you don't have access to ways to exercise, just getting out and doing stretches like this a few times a day, right? Like, you don't have to be a yoga guru to simply be able to move your body in ways. It releases the stress and the cortisol that's held in our body. And that does an amazing thing to bring healing into your body. And think about, just again, balance and nutrition wherever you have access and the resources to do that. And then sleep. So these are your main sort of like foundations of control. And then I think the other thing I would really add, it sounds simplistic, but it's really important, naming and processing. We have to be able to name, this is what's going on with me. I'm sad, I'm angry, this stinks that I have to deal with this, I feel resentful. Name it, and then have a way to process it. If you feel like doing that individually, do it through art, do it through writing, but also do it in connection with other people when you can. And that means taking out what I'm experiencing and making sense of it in some other way, so it's not held in me. I feel like HS, there's so much like held that the body is trying to manage. We got to get it out.
Yeah, absolutely. Thank you so much for that. This was very informative. We talked about not only how to support ourselves as HS patients mentally and emotionally, but we talked about sexual health, BDSM,
We
and
covered it.
and we also talked about some of the tools that we can use as HS patients to empower ourselves if we don't have access to a therapist. So all of that information is very important just for HS patients and caregivers and partners and spouses. This was a great conversation, and I really want to segue into now the Q&A. So if anybody has any questions, please feel free to enter those questions into the Q&A section because we want to get to as many as possible. So the first question is, what are the possible ways to reduce inflammation in an affected region? Please give some suggestions. I know for this question, I would say that we can give some, but we're going to talk tomorrow to physicians, tomorrow and Thursday to physicians who I think could speak more to this. Because Dr. Martinez is more of a therapist. So I know that I don't know if you have any suggestions or if you want to give any. I don't want to cut you off from doing that. But.
No, I think I'm probably not the ideal response. The one thing I would say is that we know from lots of research that stress and trauma does hold inflammation in our bodies. And so any of the things we're talking about today, I don't think they are going to have like moment to moment cures, but I think over the time frame, they will provide some of that healing.
Mm-hmm. Absolutely. I do want to mention too, some ways that you can get into reducing inflammation naturally. I'm very into holistic medicine myself, just because I'm not a person who likes pills and medication. It's just has never been my desire to take medication. But I use turmeric, so I make golden milk with non-dairy milk. So I use either cashew milk or coconut because almond milk has a lot of estrogen in it, and I don't use it for my own personal reasons. But if you want to take turmeric and cinnamon and some black pepper and put that into a cup and drink that up. You can drink it as a tea. You don't have to use milk because I used to drink it as a tea. The only thing about that is curcumin, it seems to, when you stop taking it, you have a rise in inflammation and then it kind of lowers back down. Curcumin is the same ingredient that they use in Humira, I believe, but it's kind of like a more diluted form of it. But we'll get into more of that tomorrow and Thursday. So tomorrow we have Dr. Raja, who is not a naturopathic, but he's a allopathic physician. And then we also have Dr. Hamzavi, who is a dermatologist who can speak more to that because he does clinical work. So any clinical questions, we can answer those on the coming 2 days. So we have another question from Ms. Gray. She says, I have a possible new sexual partner. He is very compassionate, and I've already talked to him about my stage 3 hidradenitis. How can I explain to him that it is genetic and nothing that he can catch? I don't want him or any other partner to think I have an STD. It's definitely put a damper on my previous exciting sex life. Also, she bought Mama IU products. I'm so glad you guys did. That's great.
Wow.
I don't know if you can speak to that.
That is, first of all, Ms. Gray, I'm so excited that you found a compassionate partner. It's not always easy in this world to find compassionate people. So excited for you about that. And you've already made it through the first hurdle. I would maybe, even if your partner is open to it, I would ask them to write out a list of myths and fears that they hold within themselves about bodies and sex and disease. And then I would have a list printed out from about HS and what we know about it and what is defined as symptoms. And also, I think it's important to identify because we see what's on the outside of the body. And I think Dr. Hamzavi and even diagrams can show what's happening kind of inside the body. as well, or underneath, right? These are, so I might, but where I would really go is to encourage this new partner to be in touch with their own misinformation and their own fear and their own myth before you share bodies, before you look at that, before you expose yourself. Because what you don't want to expose yourself to is their misinformation and their fear. And I would name it that way. You don't have to be mean, right? But I would name that. That is yours. Are you willing to work on that? That would be my quick suggestion, and happy to talk more if again, these aren't full answers, or I can't cover something, I'm happy to have you email me as well. Oh, I can't hear you.
Absolutely. And I just want to mention that we have Dr. Martinez's email address at the top of the comments in the chat bubble. If you want to email her with anything that you might not want to ask out here with everyone, and you want to just ask him privately, you can do that as well. So we want to get to the next question. So this pain management question, we are going to save for the conversation with Dr. Hamzavi and Dr. Raja, just because we want to focus on mental health with Dr. Martinez, because that's where her area of expertise is. But we really appreciate your question, and we will get to that question and ask. Just make sure that you come to the next session so that you can ask the same question and you can get the answers that you need. So we have another question. HS hit this individual during puberty. This made teens, I'm sorry. So the question is kind of how do you differentiate HS from STD symptoms? That'd be interesting to answer. I don't know if you can you can't speak to that, can you?
I don't feel like I'd be the best person to speak to that. I would only say what I've already said, is that there's tons of misdiagnosis and doctors often aren't informed of this.
Yeah, let's look. That's another question that we're gonna kind of save for the physicians that we're gonna talk to, because they can definitely speak to that at least. Let me see. How do we go about not feeling embarrassed for the disease we have, especially when HS is in the groin area with others?
In this way, I think that a lot of us in the world, in addition to HS, I don't know if anyone's ever seen the Netflix series Sex Education, but they have an episode where they're talking about vulva shame, which is a very common issue these days, because apparently there's the right looking vulva and that's the wrong looking vulva. And so I think people hold a lot of shame for how their bodies don't show up. In HS, you have the added issue, sometimes of odor, sometimes of change because of surgery to how the body looks. I don't think that there's a magical fix. I don't think I can give you something that you will leave today's talk and you will not feel shame or discomfort or embarrassment. But I think when we have secrets, or we can't name something, we know that that increases the sense of shame and discomfort, and we feel like we have something to hide. So I would really think about the self-compassion work that we do about being able to own who we are. And I would actually encourage you, if you are at a part in your life where you can, is to look at that part of your body, to have a new relationship with it. It's not the same or what you intended it or somebody said it should look like, but it is your body. And I would look at it in the mirror. I would let yourself own the feelings that come up. And then I would also encourage you to think about the parts, again, of yourself that you feel a different, more positive relationship about in those moments.
Absolutely. And that's a good segue into the next question, which is, what can you do to help a partner get over the fear of hurting you during sex and therefore shying away from intimacy?
So I think a lot of information you can provide to your partners about what actually does cause discomfort. I think a great question or comment to start any intimate experience is here's where I want to be touched, here's where I don't want to be touched. And so there's a trust issue. If you say I want to be touched, I want to be touched on my nipples, I want to be touched on my penis, then you are giving consent to that. You are saying that, and your partner has to trust that. So I would begin conversations, and you can make them sexy. You can make them fun. You know, you can text them, here's what I want to do tonight. Here's how I want to, when I see you, here's what I'd like to do with you. But get used to labeling and get them used to trusting you. I'm the person that's in charge of this body. And I'll let you know where it's good for me and where it's not. Another thing we can steal from the community, the BDSM community, is the idea of safe words. So sometimes parts of our body we think might work well, and they're not working so well for us at that moment. So it's okay to have some sort of signal or word that says, let me lean away from that and do something different than where I was. And that's the back and forth I would encourage.
Mm-hmm. Absolutely. We have two more questions.
Sure.
I think you probably answered this question already, but just to kind of reiterate, this individual had an extensive surgery, and they moved away from their partner because they were scared that he would not understand, and sex scares them to death. Can you give them some ideas of how to break the ice into the conversation? They were saying that they had a surgery, I think it was called a vulvectomy. Mm-hmm. And so, yeah.
So I guess the place I would start is to just validate how scary that feels, right? Don't push yourself, understand your pacing. And respect that as the feeling you're having, because your instinct is putting on brakes, right? It's saying, this is a lot for me. So respect that and ease into that. Start with conversations that feel manageable. Ease, pace it. Also, sex is defined often by doing stuff with our genitals. In working a lot with many different populations, not everybody defines it that way. And so we need to get out of that place. Our sexual experiences are what feel sensual and erotic to us, and they include lots of parts of our body. So my recommendation to you would be to try to look on yourself at your own body map and really discover what other parts of your body feel erotic and exciting to you. So you might come back to your genitals or you might not, but I would see what else is going on with this body that can be exciting now and kind of open that box.
Mm-hmm, absolutely. We are going to answer one more question, and then we're going to kind of wrap up, because I want to make sure I respect Dr. Martinez's time, and I know that everybody else probably has things to get back to as well. So we really appreciate you coming on to be an attendee of the HS Virtual Awareness Week Summit.
I'm honored.
Yes. So the last question is, they said, I have a new sexual partner who has been very understanding about my HS to the extent that I have explained it to him. He is extremely kind and empathetic and says I'm still beautiful to him. How do I open up against about my insecurity and let him go further in sexual intimacy, such as oral sex on me? Yeah.
I love what is pointed out in this question, which is it's hard to almost like allow space for what he's saying because of your own stuff, right? And that's where the work is. Like, how do I back myself up or let myself fall forward into this? And I think that's 90% of the work is separating those out. What are his thoughts that he's told you? You're beautiful. I want to do this with you. And what are your own fears and beliefs about your body that are coming out to the surface? And then I would think about, again, just kind of unmasking those fears, being able to say, here's what I actually come up with when you say that. Here's what sometimes hits me that's hard for me, and share some of them. And I would go slowly into kind of unveiling the experience of oral sex. There's so many pieces to that experience that are beautiful, But I wouldn't recommend, and I never recommend to anybody when there's any new element to it, like go slow and enjoy that. So I would pace yourself, and maybe just like one of the biggest parts of tools of sex therapy that we use is really just highlighting the sensual and mindfulness of touch. So I would just even try lying naked next to each other, and maybe even just like having a hand on that part of your body. Ease yourself in and see if some of those fears lift.
Mm-hmm. That's beautiful. That's a beautiful way to end this whole conversation. I love it so much. Thank you all so much for tuning in. Before you go, I just want to once again thank you, Dr. Martinez, for coming on to speak with us about sexual health and also mental health as it relates to HS patients. This has been very informative. I hope you all got a lot from this conversation. And I really appreciate you for taking time out of your day.
Thank you. I'm honored to be here, and I'm so glad that you've created this space. It's beautiful, and I wish I could see everybody, but thank you for sharing this space with me today. I think that all people surviving this are resilient human beings, and just try to embrace that power within you.
I want to once again thank our sponsors, the HS Foundation, the Mama IU, For Her Cosmetics, and HydraWear. We have a donation button. It is not a requirement, but if you would love to see more programming like this in the future, whether that be online or in person, we would love for you to support us with any monetary donations that you may have. Anything goes a very long way. And that link is available. Thank you so much. We really appreciate you all. You have a great day, and we'll see you tomorrow. Thank you again.
Jasmine.
Bye.